Everyone. It's Friday. It's November 5th already, 2021, just in case we've lost track of the year. Uh, you know, I didn't do a video last Friday, and I figured y'all really weren't expecting it because of the Halloween visits. So, and by the way, those Halloween visits were a lot of fun. Thank you, everybody. There were some incredible costumes and there were some awesome site kind of themes and decorations and so forth. So the committee is hard at work. We've got a lot of work to do in this judging, but we'll be getting those results out pretty soon. I think Amanda is hoping to be able to do that by the middle of the month, pretty quick. So those of us who were on the committee dressed up as bandits this year, which was kind of fun. We figured we had to wear masks, so we might as well put those masks to use and be a bandit and stick them up everybody. So it was fun, and I hope y'all enjoyed it. It looked like some of you really did. I missed some of you. I know that just decorating only the lobby meant that we didn't get to see and walk through a lot of the pathways and the halls and everything that we used to, and I missed that. But it was really good getting out and seeing everyone. So thank you to everybody that joined us on that very fun day. Speaking of a kind of a fun but a little bit bittersweet, last night we had a retirement reception for Liz Kirshner. Liz yesterday had her 29th anniversary, November the 4th, of being with CARE South Carolina. 29th anniversary. And we really wanted to commemorate that and give her our sincerest appreciation. She's been amazing. If you see Liz, please give her some congrats. You know, Liz goes back those 29 years and really laying a foundation for integrated behavioral health, but not just with CARE South Carolina. Many of y'all don't know the role that she has played nationally before integrated behavioral health even got to be a thing, so to speak. There was early on, there was a health disparities collaborative, the IHRSA, the Bureau of Primary Health Care, and the Institute for Healthcare Improvement. And addressing depression was one of its very first focal points. And Liz was faculty for that. And in this whole process of addressing depression, integration of behavioral health and primary care became a real national movement. It's now one of the foundations for becoming a patient centered medical home. You know, in the past, the mental health services and the doctor services or the primary care services were very siloed. And this integration model really has made a difference in destigmatizing mental health, behavioral health, and in getting services more readily available to patients. And let me tell you, Liz Kirshner was a national foundation for doing that. So our appreciations and well wishes for what lies ahead for her in the future. Say them and express them to Liz if you get a chance. On another kind of celebratory note, a couple of weeks ago I announced that we were going to have a campaign for 30,000 vaccinations. Um, that's a pretty big number of vaccination being given out. And at that time, we were a little less than 29,000, 28,000, somewhat. And we were going to have the 10 days of vaccination celebration with some incredible prize giveaways during those 10 days. Folks, we are probably going to reach that sooner than we even imagined. Although we're ready, don't worry. Amanda's got all the cool things for the prize giveaways lined up. We're ready, but we are getting really close. At the end of last week, now this is at the end of last week, we did 29,605. not before 100 away. And last week, we did 500 vaccinations alone. These boosters, folks are really lining up for these boosters. So this may be the week that we actually reach it. Today on Friday, I don't have the full week's count, but let me tell you, it's looking pretty darn good. So get ready. By the way, every single person, I'm going to repeat that, every single person working for CARE South Carolina is eligible in these drawings. Everybody. So, everybody except Denise Ellis. You know, Denise wins everything, so I think we all ought to come to a consensus that Denise's name can't be in this. I'm just kidding, Denise. Um, but it is everybody, everybody. And these are truly some prizes that everybody's going to want to have a chance at. So it's going to be happening pretty quick. I think that's really exciting. Just in case you're keeping count, as of the end of last week, we had also done 4,069 monoclonal antibody infusions. Thank heavens they have slowed down just a little bit because positive cases have slowed down. So that is, in a way, good news. But I know y'all get tired of me saying this. I know you do. I get tired of saying it. The pandemic isn't over. You know, we watch in our COVID task force group, we watch not only what's going on in South Carolina, in our own area, the PD, nationally, but we also watch what is happening internationally. And some very disturbing things have been happening internationally. In the European countries, Great Britain, Germany, Italy, France, you know, the European countries. They did, like us, had a big surge during the summer due to Delta, although theirs ran earlier than our summertime one. Their surge was more like in the spring this year. Uh, and then they had cases come down quite a bit. And then, alarmingly, they've had massive repeat surges. That's really scary. And in the case of Great Britain, the surge this go around is even higher, greater than it was during the peak of the Delta surge. There's been some eyes on that, and why on earth would that be happening? And conclusions have been made that when the surge back in their spring happened and then got over with and things got so much better that people started getting relaxed. People started taking a deep breath and saying, oh, the pandemic is over, thank goodness. And it wasn't. It wasn't over. Instead, it came back with a vengeance. So I'm really worried. I don't want that to happen. The United States does not have a very good track record, either in terms of vaccination or in terms of how we handle our own precautions. This surge was even happening in countries with pretty good vaccination rates. Yeah, there have been some breakthroughs, but at least when there were breakthroughs, there weren't deaths and serious hospitalizations. So, you know, our message is I know we're tired. I'm tired. I'm tired of being tired. I'm tired of being anxious. I'm tired of being scared. I'm tired of not wanting to get sick. I'm tired of all of that, right along with the rest of you. But we can't let our guard down. We have to be very, very cautious. And this worries me because, yeah, today's November the 5th. Thanksgiving's next, and right on the heels of that are the holidays. That's when we all like to get together, and that's when we all like to uh, try to remind ourselves that there's not really a pandemic out there. I want to encourage y'all to do everything in your power to be very cautious. We're supposed to be getting some free rapid test kits. Um, we've heard from HRSA that the FQHC should be able to be expecting these, frankly, right around now. We're going to provide these to you, employees, when we get them, so that you can, if nothing else, test. Test yourself. Test yourself before you go join that family and you don't know who's vaccinated and who's not. Test yourself when you come back. Test. Rapid, widespread testing could have been one of the tools if we had more availability of widespread rapid testing. That could have been one of the tools that could have helped control this pandemic. These rapid tests are becoming more and more available. And when we get ours for free, you are our first priority, and especially over the holidays. So, um, waiting for that to come, and the priority will be all of you, every one of you. So, um, we're going to do everything in our power to help out with what we know is going to be pretty difficult coming up. So, let's go ahead and talk about the elephant in the room. The vaccination as a healthcare requirement for employment at CARE South Carolina. If you've been on the news, which you always amaze me, everybody seems to get news even sometimes before I've heard it. You know that CMS released its mandate yesterday, November the 4th. Perhaps you had time to read it and go through it. I have talked about this in prior videos. It was part of the reasoning behind the board adopting the policy back in September, that vaccination for COVID-19 would become a health requirement, along with numerous other health requirements for employment at CARE South Carolina. Annual flu vaccine, PPDs if you're in the clinical department. So, in that manner, we've known this CMS mandate was coming. We've known also that it was not going to be subject to an awful lot of uh, legal manipulations to try to get it repealed. This isn't CMS's first time at the rodeo. That's one of the biggest agencies in Department of Health and Human Services. CMS stands for the Center for Medicaid and Medicare Services. They are directly responsible for all of our Medicaid and Medicare services. In other words, they're a big, big, big fish. So they issued their mandate yesterday. Now, attached to the email that I give y'all for the connection information, I'm going to put this new guideline as an attachment, so you'll be able to read through it a lot, a lot more slowly than what I'll be sharing with you on this video per se. But in a nutshell, what CMS is saying is that by December the 5th, I'm going to repeat that, by December the 5th, all employees at healthcare centers, any center that receives payments from Medicare and Medicaid, must have either had their one shot of Pfizer or Moderna, or they could choose Johnson & Johnson. Then by January the 4th, they must have completed their second shot of Pfizer or Moderna, or by then it's the drop dead date for the Johnson & Johnson. I know that can get a little confusing, and that'll help whenever you can see this in writing. So in other words, CMS has made the dates known and the requirements very clear. We've been preparing for this because we certainly didn't want to be caught unawares. Some of you out there may be thinking, well, so what? Just don't accept the Medicare and Medicaid payments. We can't do that. The Medicare and Medicaid payments last year at CARE South Carolina in 2020 were $24 million. We can't just say we're not going to accept Medicare and Medicaid. That would be a tremendous disservice to those patients on Medicaid and to those older and blind, aged, and disabled patients on Medicare. So that is not even an option. Not only that, if we lose our Medicare, Medicaid authorization, we would also lose our ability to be a 340B provider. And frankly, the pharmacy brings in as much revenue as do the payments from Medicare and Medicaid. So literally, if we gave all that up, we would essentially just be a private practice with a carriage trade that only saw patients with insurance, and we would probably just have one office. And it's not an option for CARE South Carolina. So this is what we are going to comply with. We've been getting ready for this. We've known it was coming. We have the town hall that's coming up on the 23rd. We designed this town hall to talk specifically about things that haven't really had a lot of discussion before in the past. I'm not going to try to steal the thunder from our panelists because these panelists are extraordinary. I am frankly blown away that they are willing to commit to CARE South Carolina and the employees we have and the people we serve, because this is going to be a Facebook Live broadcast. And remember, it's going to have four panelists. The first one is going to talk about the history around what our nation has always done in vaccination mandates, the legal premises of it. The Honorable Jay Hodge, the attorney who was also the board chair at CARE South and at one time was the Fourth Circuit Court solicitor, would be giving us a lot of information around this. Do you know that the mandate for vaccination, as you may call it, against the disease goes back as far as George Washington in 1777. He issued a mandate that all of the soldiers in the Revolutionary Army had to be inoculated for smallpox. They didn't have vaccination back then. You were actually inoculated with a live virus. Well, that was pretty tough. And of course, we've all had, if we went to school or what have you, we've had mumps, measles, polio vaccinations. Vaccinations are not a new thing. CARE South has been requiring flu vaccinations. So there is a sound history of vaccination in the United States. And there is a sound history of the Supreme Court upholding vaccination requirements. They do so for the public good. And there has been case after case that's brought. There's been some even recent cases that have been brought in local districts and even before the Supreme Court that have upheld vaccination requirements. So the legal and the historical perspective of vaccination is pretty sound. Our next panelist, Dr. Rick Foster, is going to give us some thought-provoking context around the ethical considerations around vaccination. And I found this quote. I'm not going to steal Dr. Foster's thunder, but this is a quote that comes from Potter Stewart. He was an associate Supreme Court justice. And this was actually having to do with one of the arguments around things that were being required of individuals that would benefit the good of the whole. And this is what he said. Ethics is knowing the difference between what you have a right to do and what is the right to do. I like that. Ethics. Ethics knows the difference in you having the right, but knowing that it's the right thing to do. I want y'all to think about that. And then we've got Dr. Thaddeus Bell. Dr. Bell is going to be talking about the religious and moral underpinnings that are there for a vaccination requirement. And you know, every single major religious entity in the United States has come out and spoken for vaccination. Um, the Vatican, even after they ascertained that the cell lines were not derived from fetal tissue, they support full vaccination. Every single one of them, even um, in the voice of the National Institutes for Health's director, who is himself, he's an evangelical, he's part of the evangelical religion, says that he himself is vaccinated and he would encourage everyone to seek vaccination. It is clear that we have a moral obligation to do no harm and to think about the public and the good that we are doing for not just ourselves, but the public as a whole. When we're vaccinated, we help prevent transmission. We really are looking after the safety of those who cannot get vaccinated. Now, I know that the vaccine has been approved for 5 to 11-year-olds, thanks heavens. Those poor kids were extremely vulnerable. And we've had deaths in that age group. There have also been some very severe illnesses. I'm not sure about the statistics around deaths of very young kids. So, we have a moral obligation as individuals. Not only that, Dr. Kelly is going to come back with us, Dr. Jane Kelly. Research has been hard at it over these last several months, and there is a lot of emerging concerns around what's going on after folks have COVID, both in the short term and in what they're calling long COVID. And I'll tell you, it's just about frightening what folks are experiencing, even if initially they had very mild COVID. Um, it's pretty alarming. I'm not going to steal Dr. Kelly's thunder either, but it also is pretty alarming what is happening after people have COVID. So, protecting yourself, protecting others. I always go back and I think about what is the mission of CARE South Carolina. Uh, just like Liz, with her 29 years, said the other night that she was privileged and felt so good about being able to work with an organization who every day made a difference in lives of many people who otherwise would not have access to care. I feel the same way. The mission of CARE South Carolina to improve and enhance the health and well-being for everyone is really a privilege. It's a life's purpose for me. It's what gets me up every morning. I can only pray that I hope it is the same for you because that is what drives us. And that is truly what I believe is the underpinning of why this vaccination health employment requirement is so important. We vaccinate not only to protect ourselves, but to protect our friends, our families, our communities, all of those around us, and for the health and the well being of everyone. We vaccinate to keep the hospitals from being overrun when the flu starts ramping up. We vaccinate to keep the death rates down. We vaccinate because it is the right thing to do. Thank you all. Take care of yourselves. Bye bye.